Are you or someone you love over 60 and taking multiple medications? You could be just one prescription away from a dangerous drug interaction and not even know it. Every year, thousands of seniors land in the emergency room, not because they took the wrong pill, but because the right pills were taken together. From over-the-counter pain relievers to common blood pressure meds, mixing medications can silently damage your kidneys, raise your stroke risk, or even affect your memory. Today, we're diving deep into the top drug combinations seniors should avoid, why they're dangerous, and what to do instead, naturally and safely. This isn't about fear. It's about being informed and empowered. Stay with us because your health or your loved ones might depend on this. As we age, our bodies change. Our kidneys slow down. The liver becomes less efficient at breaking down medications. And our sensitivity to drugs increases. Most people over 60 take at least 5 medications daily. Some take more than 10. These include prescriptions, over-the-counter remedies, and supplements. But here's the problem. Doctors often don't know everything you're taking, and medications that were once safe can suddenly become dangerous together. That's where drug interactions come in. They happen when one drug affects how another works, making it stronger, weaker, or more toxic. Some combinations can spike blood pressure, slow your heart, cause internal bleeding, damage your liver or kidneys, confuse your brain, and many interactions happen silently, with no warning signs, until something serious happens. So today, we're going to uncover the 7 most dangerous drug combos for seniors, signs you may be experiencing an interaction, what to ask your doctor or pharmacist, and natural ways to reduce your medication load safely. Let's start with one of the most common and most overlooked combinations. Let's start with one of the most dangerous combinations out there, yet it's one of the most common among seniors. Blood thinners plus NSAIDs. If you're taking warfarin, Coumadin, clopidogrel, Plavix, or even aspirin for your heart, and you reach for something like ibuprofen, Advil, naproxen, Aleve, or even regular-strength Motrin for arthritis or back pain, you could be setting yourself up for internal bleeding. Here's why. Blood thinners reduce clotting to protect you from strokes or heart attacks. NSAIDs, on the other hand, irritate the stomach lining and thin the blood even more. The result? A double whammy. Your body's natural ability to stop bleeding is impaired, and your stomach lining is more fragile. Symptoms may include dark stools, vomiting blood, sudden fatigue or dizziness, abdominal pain. But often, there are no early signs until the damage is done. Even baby aspirin can be risky when combined with NSAIDs. And it's not just about prescription meds. Many seniors self-medicate with over-the-counter painkillers, unaware that they're creating a perfect storm inside their body. What should you do instead? Talk to your doctor before combining pain relievers with any blood thinner. Consider acetaminophen Tylenol as a safer alternative, though it comes with liver warnings. Use natural anti-inflammatories like turmeric, ginger, or omega-3s, but still consult your healthcare provider. Explore non-drug pain management like heat therapy, physical therapy, or gentle stretching. And here's something most people forget. If you've been on aspirin for years just in case, but your doctor has prescribed another blood thinner, you may no longer need the aspirin. Combining both without supervision increases your risk. Always bring every single pill you take to your appointments, even supplements. Many doctors aren't aware of what you're taking unless you show them. This combo is just the beginning. Up next, we'll cover a pairing that can mess with your brain, and most seniors aren't even told about it. Now let's talk about one of the most deceptive and dangerous combinations for older adults. Anticholinergic drugs combined with sedatives. These medications are often prescribed or picked up over the counter, without any thought to how they might interact. But together, they can dramatically increase the risk of memory problems, confusion, drowsiness, and dangerous falls. So what are we talking about exactly? Anticholinergic drugs include common medications like diphenhydramine, Benadryl for allergies or sleep, oxybutynin for overactive bladder, tricyclic antidepressants like amitriptyline, some muscle relaxants, and anti-nausea drugs. They block a neurotransmitter called acetylcholine, critical for memory, focus, and muscle coordination. Now combine one of these with a sedative like benzodiazepines, Valium, Xanax, Ativan, sleep aids, Zolpidem or Ambien, even some cold and cough medicines. What happens next? You're doubling the sedation effect, slowing reaction time, impairing balance, and increasing confusion, especially at night. Studies show that seniors who regularly take this combo are more likely to fall and break a hip, at significantly higher risk for dementia, and more likely to be hospitalized for delirium. And the scariest part? These effects are often mistaken for normal aging. So what can you do? Safer alternatives and solutions. Ask your doctor to review your meds annually for anticholinergic load. If you use Benadryl for sleep, stop. It's not meant for long-term use and worsens cognition. For bladder issues, explore pelvic floor exercises or consult a urologist for safer options. Replace sedatives with behavioral therapy for sleep or natural solutions like magnesium, chamomile, or melatonin in low doses. Tip: use the Beers criteria as a reference. It's a list of potentially inappropriate medications for older adults, developed by geriatric experts. Many anticholinergics are on that list. Medication doesn't have to be the enemy. But when the wrong ones mix, or the right ones mix in the wrong way, your brain and balance suffer. Up next, we'll look at another hidden combo, one that affects millions with high blood pressure and diabetes. Now let's talk about a combination that seems harmless, but can quietly put your heart at serious risk. ACE inhibitors plus potassium supplements or potassium-sparing diuretics. ACE inhibitors like lisinopril, enalapril, or ramipril are commonly prescribed to treat high blood pressure and protect the kidneys, especially in people with diabetes. They're effective, but they also cause your body to retain potassium. Now imagine adding a potassium supplement or a potassium-sparing diuretic like spironolactone or triamterene into the mix, often unknowingly. The result? Too much potassium in your blood. This condition, known as hyperkalemia, can be deadly. It disrupts your heart rhythm and may lead to palpitations, muscle weakness, nausea, and, in extreme cases, cardiac arrest. And the scary part? You might not feel anything until it's too late. Here's the kicker. Many seniors take over-the-counter supplements or sports drinks rich in potassium, thinking it's healthy. But combined with ACE inhibitors, these choices can backfire fast. Here's what to do. Never take potassium supplements unless your doctor explicitly tells you to. If you're on an ACE inhibitor, limit high-potassium foods like bananas, oranges, tomatoes, avocados, and spinach. Get your blood potassium levels checked regularly, especially after medication changes. Avoid salt substitutes containing potassium unless approved by your doctor. Also, don't assume natural means safe. Even herbal supplements like dandelion or alfalfa can raise potassium. And here's something many people forget. Kidney function declines naturally with age, so your ability to process excess potassium drops too. That makes this combo even riskier for seniors over 60. By staying aware, asking the right questions, and checking labels carefully, you can protect your heart from a completely avoidable threat. Next, we'll reveal a combination that might weaken your bones and go unnoticed until something breaks. Now let's explore a drug combo that millions of seniors take without knowing it's quietly weakening their bones. Proton pump inhibitors, PPIs, plus diuretics. PPIs such as omeprazole, Prilosec, pantoprazole, Prodnix, and esomeprazole, Nexium, are used to treat acid reflux, GERD, or ulcers. They work by reducing stomach acid. Sounds helpful, right? But here's the catch. Stomach acid isn't just for digestion. It's essential for absorbing key nutrients, especially calcium and magnesium, which are vital for strong bones and muscle function. Now let's add diuretics like furosemide, Lasix, hydrochlorothiazide, HC-Z, or bumetanide, often prescribed for high blood pressure, swelling, or heart failure. Diuretics flush excess fluid from the body, but in the process, they also flush out electrolytes and minerals, including calcium and magnesium. What happens when you take both? Reduced calcium absorption from PPIs. Increased calcium loss from diuretics. A dangerous setup for osteoporosis, muscle cramps, and even life-threatening arrhythmias. Studies show that long-term PPI users, especially those over 60, are at a significantly higher risk of hip, spine, and wrist fractures. And when combined with diuretics, the risk skyrockets. But here's something even more alarming. Most people take these drugs for years, often without reevaluation. A stomach ache or some swelling years ago turns into daily medication, and bones silently suffer. How to protect yourself. Don't take PPIs longer than 8 weeks, unless absolutely necessary. They're meant for short-term use. Ask your doctor if you really need a PPI, or if a lower-dose H2 blocker like famotidine, Pepcid, could work instead. Make sure your calcium intake is adequate. Through food first, then supplements if needed. Ensure you're also getting vitamin D, which helps absorb calcium and keeps bones strong. If you're on a diuretic, ask your doctor to monitor your bone density and electrolyte levels regularly. Pro tip: some seniors do better on potassium-sparing diuretics in lower doses or non-PPI options for acid reflux, like lifestyle changes, elevating the bed, smaller meals, avoiding late-night eating. This combo might not cause symptoms today, but your bones may be paying the price every day. Next, we'll uncover one of the most overlooked yet dangerous combinations involving blood thinners and common painkillers. This next combination is extremely common and incredibly dangerous. Blood thinners plus NSAIDs. Let's start with blood thinners. These include warfarin, Coumadin, clopidogrel, Plavix, apixaban, Eliquis, rivaroxaban, Xarelto. They help prevent blood clots, strokes, and heart attacks. But they also increase your risk of internal bleeding. Now add NSAIDs, nonsteroidal anti-inflammatory drugs, like ibuprofen, Advil, Motrin, naproxen, Aleve, aspirin, especially in higher doses. NSAIDs reduce pain, inflammation, and fever. But they thin the blood too, just not as precisely as prescribed anticoagulants. When these drugs are combined, even temporarily, they double or triple your risk of gastrointestinal bleeding, stomach ulcers, bleeding in the brain or elsewhere. And here's what's truly alarming. Many seniors take NSAIDs over the counter without even realizing they're mixing medications. For example, someone on Eliquis takes Advil for arthritis pain, or a person on Plavix also takes aspirin for daily heart protection. They think they're being cautious, but they've unknowingly set themselves up for serious harm. Let's paint a picture. Imagine a small tear in your stomach lining. If you're not on any blood thinner, your body clots it. You may never notice it. But if you're on a blood thinner and then take an NSAID, your blood can't clot properly. That tear can become an ulcer, and then, potentially, a life-threatening internal bleed. And it doesn't stop at the stomach. Bleeding risks include gums, urinary tract, brain, especially after a fall. Falls are especially concerning in older adults. A seemingly minor head bump, when mixed with blood thinners and NSAIDs, could lead to brain hemorrhage. So what can you do? Smart ways to stay safe. Avoid NSAIDs altogether if you're on a blood thinner, unless specifically told otherwise by your doctor. If you need pain relief, acetaminophen Tylenol is usually safer. It doesn't thin the blood. Always inform your doctor and pharmacist about every medication you're taking, including over-the-counter painkillers, supplements, and vitamins. If your doctor advises daily low-dose aspirin and a blood thinner, ask, is this still necessary? Guidelines have changed in recent years, and in many cases, one may be enough. Watch for early signs of bleeding, unusual bruising, black, tarry stools, blood in urine, severe headaches or dizziness, nosebleeds that won't stop. These could be warning signs that something's wrong. Here's a real-world example. Joan, a 72-year-old on warfarin for AFib, had chronic knee pain. She didn't want to bother her doctor, so she took ibuprofen daily for a week. By day 6, she had black stools and fatigue. She was rushed to the ER with a bleeding ulcer and spent 3 days in the hospital, all because of a common mistake millions of people make. And that's the key takeaway. You don't have to be reckless to be at risk. Sometimes trying to be careful, taking meds to avoid a stroke or manage pain, can become dangerous when the combinations aren't checked. So always ask, could this over-the-counter pill interact with my prescriptions? Bring your full list of medications to your doctor at least twice a year. A simple review can save your life. Up next, we'll cover a combination that can quietly raise your blood pressure, undoing your treatment goals without you even knowing it. This next combination is especially tricky because it involves something we all reach for during cold and allergy season, decongestants. If you're taking medication for high blood pressure, like lisinopril, amlodipine, metoprolol, losartan, then grabbing an over-the-counter decongestant like pseudoephedrine or phenylephrine might seem harmless. But here's the problem. Decongestants narrow blood vessels in your nasal passages to relieve stuffiness. But they also raise your overall blood pressure and heart rate. That means these medications counteract your blood pressure meds, making them less effective or even completely ineffective. Worse yet, many decongestants are hidden inside combination cold medications, often labeled as non-drowsy or daytime relief. So seniors might be unknowingly taking something that's undoing their treatment. What to do instead? Choose saline nasal sprays or humidifiers for congestion relief. Use antihistamines like loratadine or cetirizine, which don't raise blood pressure. Always check the label for ingredients like ephedrine or phenylephrine. Your blood pressure treatment works hard to protect your heart and brain. Don't let a cold medicine quietly push it in the wrong direction. Coming up next, we'll discuss a combination that may increase your fall risk, especially at night. As we age, many of us struggle with two things: sleep and anxiety. It's common to be prescribed medications to manage both, but that's where the danger begins. Let's talk about sedatives and anti-anxiety meds like diazepam, Valium, lorazepam, Ativan, alprazolam, Xanax, zolpidem, Ambien, temazepam, Restoral. These are often prescribed for short-term use, but some seniors end up taking them for months or even years. The danger comes when these medications are combined, either with each other or with opioid painkillers or over-the-counter sleep aids. Why? Because they all slow down your central nervous system. When stacked together, they can cause extreme drowsiness, slurred speech, confusion, poor coordination, and worst of all, loss of balance. This dramatically increases your risk of falls, especially during nighttime bathroom trips or early mornings when you're groggy. And for older adults, a fall isn't just a bruise. It can mean broken hips, head trauma, hospitalization, long-term disability. In fact, falls are one of the leading causes of death and injury in adults over 65. Even worse, these drugs can impair memory, create dependence, and increase the risk of dementia with long-term use. Safer strategies? Consider non-drug sleep techniques, light therapy, consistent sleep-wake times, no caffeine afternoon. Use short-term sleep meds only when truly necessary. Ask your doctor about weaning plans if you've been on these meds for more than a few weeks. Never combine them with alcohol or other sedatives, even over-the-counter ones like diphenhydramine, Benadryl. If you're concerned about a loved one who seems overly sedated or is falling frequently, check their meds. What's helping them sleep might be silently putting them at risk. If you or a loved one is managing type 2 diabetes, this combination could be silently dangerous. Beta blockers like metoprolol, atenolol, propranolol are often prescribed for high blood pressure or heart issues. On their own, they work well. But when taken with insulin or oral diabetes medications like glipizide or glyburide, they can cause a big issue. They mask the symptoms of low blood sugar, hypoglycemia. Normally, when your blood sugar drops, you feel shaky, anxious, sweaty, fast heartbeat. But beta blockers block those warning signs, especially the rapid heartbeat. That means you might not know your blood sugar is dangerously low until you faint or have a medical emergency. For seniors living alone, this can be especially risky. What to do? Monitor blood sugar more frequently. Use a continuous glucose monitor, CGM, if possible. Discuss safer med options with your doctor. Unnoticed hypoglycemia can be just as dangerous as high blood sugar. Don't let it sneak up on you. Many seniors take blood thinners like warfarin Coumadin, apixaban Eliquis, rivaroxaban Xarelto to prevent strokes or heart attacks. These are powerful and life-saving medications. But when combined with common NSAIDs like ibuprofen, Advil, or naproxen, Aleve, the risk of internal bleeding skyrockets. NSAIDs irritate the stomach lining, and blood thinners reduce the blood's ability to clot. Together, they create a perfect storm that can lead to stomach ulcers, gastrointestinal bleeding, life-threatening hemorrhages. The scary part? The signs aren't always obvious. A slow internal bleed might only show up as fatigue, dark stools, or dizziness until it becomes a medical emergency. What's safer? For pain, use acetaminophen Tylenol. Instead, it's easier on the stomach and doesn't thin your blood. Always tell your doctor or pharmacist if you're on a blood thinner before taking any pain medication. This combo might seem harmless, but it can be deadly. Don't gamble with your blood. As we've seen, even the medications meant to help can turn harmful when combined in the wrong ways, especially as we age. But here's the good news. You have more control than you think. Start by keeping an updated medication list, prescriptions, over-the-counter meds, supplements, even vitamins. Bring it to every doctor's appointment. Ask questions like, is this combination safe for my age? Could any of these drugs interact? Are there safer alternatives? Don't be afraid to advocate for yourself or your loved ones. Many harmful combinations slip through the cracks because no one sees the full picture except you. And always remember, Pharmacists are a great resource. A quick call to your local pharmacy could prevent a dangerous mix-up. If this video helped you, share it with someone who takes multiple medications. It might just protect their health or even save their life. Stay informed, stay safe, and take charge of your health. Thanks for watching.